We have our Lucan's trap. We're going to utilize also, again, maintaining sterile field. Opening it up so I can then access it. Nice job there, Rick. Alright. So, when you're doing this procedure, you want to make sure that you have one hand that is always sterile, one hand that is non-sterile. It's up to you, whichever one you want. Usually, most people will use their dominant hand as their sterile. Prior to the procedure also, you want to make sure that you have everything else that is necessary. So I got my water open, so I'm going to put it into my basin. Now I can go ahead and turn a little bit this way.
I'm going to come around.
I can go ahead and grab this. And I can go ahead. It should be this way. I don't have my gloves on. I'm going to grab my gloves. And go ahead and grab my second glove. And at this point, both of these are sterile. So I'm going to designate this as my sterile hand and this is my non-sterile. I'm going to take my non-sterile and go ahead and fill my basin. And you want to be careful when you have this catheter that you always have it so it's maintaining in a sterile fashion. One of the big mistakes that people make is they don't have it secure, so that the catheter starts flinging all over the place, and it's a great way to break sterility. I'm going to go ahead then, attach it to my suction catheter, and now this is going to be non-sterile, but the catheter itself is still sterile. When you're holding it, make sure that you always have it so that it's not flopping all over the place. I'm going to go ahead and pre-oxygenate my patient. Then I'm going to go ahead and remove the oxygen, or remove him from the ventilator. I'm going to insert the catheter until I hear cough, cough, cough. And then I'm going to do intermittent suction as I'm removing the catheter out. Now that I've done my one pass, I'm going to go ahead and collect a sample. And for that, I need to splice in my Lucan's trap. Helps to hold it like this so that everything is secure. And I'm going to go ahead and advance, cough, cough, cough. And I collect my sample. You only need about a size of a dime, so it doesn't take a lot to be able to accomplish it. Now is the tricky part. I need to take this apart using just one hand. Wiggling it probably is your best bet. I can go ahead and label that, send it off to the lab. And if the patient needs some more suctioning, do some more oxygenation, go ahead and advance it, cough, cough, and remove it. And that's open suction with sampling.